If your doctor just celebrated getting your blood pressure down to 120 over 80 and you are over 50, do not celebrate yet, because a major 5-year study tracking over 15,000 adults just revealed something that contradicts nearly everything we have been told. That so-called perfect number your doctor is chasing? For people your age, it may actually be working against you. Stay with me, because what you are about to hear could change how you manage your health for the rest of your life. Here is what is happening in clinics across America every single day. A 55-year-old walks in for a routine checkup. Blood pressure reads 145 over 86. The doctor pulls up the standard guidelines, sees the target of 130 systolic, and immediately reaches for the prescription pad. 6 months later, that number is down to 124 over 78. The doctor is pleased. The patient feels like they won. Everyone thinks this is a success story, but here is what the guidelines are missing. That same person now stands up from bed at 2 in the morning, and their blood pressure crashes from 124 over 78 down to dangerous levels within seconds. Their brain is not getting enough blood. The room spins. They reach for the wall and miss. Now we are not talking about blood pressure numbers anymore. We are talking about a fall, a fractured hip, emergency surgery, weeks in rehabilitation, and a cascade of complications that can permanently change someone's life. This scenario plays out thousands of times every day, and most of it is completely preventable. Here is the part that is going to sound completely backwards, but the science fully supports it. After 50, your cardiovascular system is not simply an older version of what it was at 35. 3 critical things change that completely rewrite the rules of blood pressure management. The first is arterial stiffness. Think of a brand new garden hose. Flexible, smooth, able to bend easily. Now think of a hose left in the sun for 20 years. Stiff, brittle, barely bends at all. Your arteries go through a remarkably similar process as you age. When your heart pumps blood into stiff arteries, those walls cannot expand and absorb the pressure wave the way young, flexible arteries can. This means your body actually needs a slightly higher baseline pressure to push adequate blood flow up to your brain and vital organs, especially when you are upright and working against gravity all day long. The second critical change is something called baroreceptor slowdown. Baroreceptors are tiny pressure sensors inside your blood vessel walls. In a young person, the moment they stand up, these sensors detect the pressure drop within milliseconds. The heart rate increases, blood vessels tighten, pressure stabilizes, all before dizziness can even begin. But after 50, these sensors respond more slowly, and if your blood pressure has already been pushed low by medication, your body simply cannot compensate fast enough when you stand. That split-second delay is exactly when falls happen. Now here is what the research actually found, and these numbers matter. A study in JAMA Internal Medicine followed over 15,000 adults above 50 for 5 full years. What they discovered? Flipped conventional wisdom completely. The group with the lowest mortality rate was not the group below 120. It was the group sitting between 130 and 140 systolic. The people who hit that textbook perfect number had a 28% higher risk of serious falls. Their mortality rate was 14% higher than the moderate group. The sweet spot for survival was not at the bottom. It was in the middle. There is also a third factor almost nobody discusses: the morning surge. Between 6 and 10 in the morning, your body releases a natural burst of stress hormones as it wakes up. After 50, with stiffer arteries, that surge can spike your systolic pressure by 20 to 30 points above your nighttime level. The single reading your doctor takes at 2 in the afternoon tells you almost nothing about what your heart is experiencing every single morning. And then there is white coat effect, the genuine stress response simply from being in a clinic. Studies show this is measurably stronger after 50. One office reading could be sitting 15 to 20 points above your true resting average, which means your doctor may be treating a number that does not even reflect your real blood pressure at all.
There is one more number most people completely ignore: the diastolic. That bottom number on your reading. After 50, what happens to the diastolic becomes critically important. Very low diastolic pressure reduces blood flow to your heart muscle during the relaxation phase between each beat. If your diastolic is consistently below 65, even if your top number looks perfect on paper, your heart may not be receiving adequate blood flow. This is called isolated systolic hypertension. and it responds very differently to medication than standard high blood pressure. Treating it the same way often pushes the diastolic dangerously low. So what should your numbers actually be? After 50? Here is what the research supports. For adults aged 50 to 64 who are generally healthy, a systolic range of 125 to 135 provides strong cardiovascular protection without the risks of aggressive overtreatment. For adults 65 and older, the evidence supports a range of 130 to 142 systolic, slightly higher, because your arteries are stiffer and your pressure sensors respond more slowly. On the diastolic side, aim to keep it above 70. Consistently below 65 warrants a direct conversation with your doctor. Here is what you can do starting tonight. Get a home blood pressure monitor and check your pressure at the same time every morning and every evening for 2 weeks. Write every reading down. This gives you real data, not a single snapshot taken in a stressful office. Upper arm monitors only, not wrist devices. After 2 weeks, you will have a blood pressure picture that is actually meaningful. Then bring that log to your next appointment and have the real conversation. Do not simply accept a blanket target of 120/80. Ask your doctor what number is appropriate for your age, your conditions, and your functional health. You are not just a number on a chart, and your treatment should not be either. You now understand something that most people your age, and honestly, many healthcare providers, do not fully grasp. Blood pressure targets are not one size fits all. After 50, moderately higher numbers are often associated with better survival, better cognitive function, and fewer dangerous falls than that so-called perfect reading. The sweet spot is in the middle, not at the bottom. Walk into that next appointment informed, prepared, and confident. Your health is worth that conversation. If this video helped you, please like this video and subscribe the channel